name is Amy. I'm going to be your nurse today.
Hello.
Can you just confirm your name and date of birth for me?
Yeah, I'm Grace Wakadia, March 26, 1980.
Alright, so I understand you're just here for a full physical assessment today. Alright, well let's just go ahead and get started with that. So can you tell me your height and weight?
I'm 5'4", I weigh 160.
Okay, and I would take her pulse, blood pressure, respirations, temperature, and on a scale of 0 to 10, 0 being no pain at all, how much pain would you say that you're in today?
No pain. Zero.
Alright, well I'm going to go ahead and get started then. Do you know where we are right now?
Yeah, at Capital Region.
And do you know what today's date is?
Yeah, it's April 27, 2017.
And do you know who the current president is?
Yeah, Donald Trump.
Okay. Well, I'm going to start by just assessing your skin here. Can I see your hands? I'm going to assess for temperature. It feels nice and warm. They feel dry, feel smooth. I'm going to go ahead and take that skin turgor and the capillary refill, and both of those are prompt. I don't see any lesions or anything. Smooth, dry. So yeah, I think you are good to go there. And I'm going to go ahead and look at your cranium here. Cranium looks symmetrical. Scalp looks nice and healthy. I don't see any lesions or anything. And hair is present and looks clean. And so I'm going to go ahead and move to your temporal artery here. Feels good. And your temporomandibular joint. Can I have you open your mouth for me and close it? So that's intact. I'm going to feel your maxillary sinuses here. Do you feel any tenderness? Okay, and with the frontal sinuses, do you feel any tenderness? Alright, and I'm going to have you smile for me. And I'm going to have you scrunch your eyes real tight. Alright, very good. So now I'm going to move to your eyes. I'm going to stand behind you here. And I want you to let me know when you see my fingers, okay?
Yeah, I see that.
Okay. And I'm going to take this card. I'll hold it 14 inches from your eyes. And I want you to read to me the lowest line that you can read.
4, 2, 6, 7, 9, E.
Okay. And that is 20/20 vision. I'm going to have you follow this with your eyes. Okay. And I'm going to shine this in your eyes a little bit. Just look straight at me. Testing that pupil response. On this side as well. Okay. And the external structures of the eye look good. The conjunctiva is clear. I don't see any lesions or anything. So I'm going to move on to the ear. The external structures look normal. I don't see any lesions or anything on the ear. Do you wear any assisted hearing devices or anything?
Yeah, I do.
Okay, I'll make a note of that, and now I'm going to go ahead and take a look in your ear. Just looking at the ear canal and the eardrum, and both of those are intact. And I do that in both ears. And I'm going to go ahead and stand behind you here. I'm going to whisper a series of letters and numbers, and I want you to repeat what I said. And I'm going to do this one ear at a time. I'll do your left ear first, so if you can put a finger in your right ear and just kind of move it around. All right, you ready? Couldn't hear anything?
No.
Okay, let me try one more time.
AC is all I had.
Okay, I'll make a note of that, and you can switch ears.
GF2.
Very good. All right. And now I'm going to take this. It vibrates. I'm going to put it on the bone right behind your ear. and you're going to hear it through the bone there. I want you to let me know when you stop hearing it, and then I'll move it to just in front of your ear, and I want you to let me know when you stop hearing it there as well. Okay?
Can't hear it. Can't hear it.
Okay. And on this side.
Can't hear it. Can't hear it.
Okay. And now I'm going to place this on top of your head, and I want you to let me know if you feel it more on one side or the other, if it's equal. All right, sound good?
I'm not hearing it.
Okay, let me try again here.
I feel it more this side.
Okay, I will make a note of that. And now I think we are good to move on to the nose. Just looking at the external structures, I don't see any abnormalities, no lesions or anything. I'm gonna have you plug one nostril and breathe in and out. Okay, and just stay on the other side. All right, and now at the mouth, the lips look nice and moist. Can I have you open your mouth? Tongue looks nice and moist and pink. Can you smile for me? Teeth are intact, gums look good as well. I'm gonna shine a light in there. Hard and soft palate are both intact. Can you say ah? Alright, tonsils are also intact, so that looks good. And now I'm gonna look at the neck. It looks symmetrical, just looking at it here. I don't see any pulsations or anything. I'm gonna go ahead and feel that carotid pulse. Okay, I'm gonna feel for any lumps. The lymph nodes don't feel swollen. Do you feel any tenderness? Okay, trachea is in the midline. And feel the lymph nodes on the back there. And the thyroid doesn't feel swollen or anything either, so that feels good. I'm gonna have you look down towards the floor, up towards the ceiling, and look over both your shoulders. And I'm gonna have you put your ear to your shoulder, and on the other side. Alright, very good. And now I'm gonna move to your back. And I'm going to, I would do this on just naked skin usually. And I'm going to look at the color. If the color looks normal for her, check for any lesions or anything. I'm going to feel for any tenderness or lumps. Do you feel any tenderness? Okay. And the temperature is nice and warm. I'm gonna have you take a nice deep breath for me. Okay, that expansion is symmetric there. And now I'm going to feel for those spinous processes. Those all feel good. And now I'm going to put my hands on your back, and I want you to say 99 each time I move my hands, okay?
99, 99, 99.
Okay, and I'm going to go ahead and do some light taps on your back, just checking for any abnormalities, okay? Alright, now I'm going to have a listen. Listen in each spot for a full breath. Okay, and those breath sounds are clear, so I'm going to move to the front. And I would assess her respiratory rate, rhythm, depth, and effort. Doesn't appear that she is requiring too much effort to just breathe on her own. And now I'm going to go ahead and look at her chest. just making sure it's symmetrical here on the front as well. And the color looks good for her. And I'm going to feel here for any tenderness or lumps. Do you feel any tenderness at all? Okay. Okay, and I'm going to do those taps again up here. All right, and now I'm gonna listen. And I think that is it for that. I'm going to go ahead and move to the heart. And I'm going to just listen here, I guess. We'll listen to the aortic area, the pulmonic area, the mitral area, and the tricuspid area. Okay, and I'm gonna have you sit up real straight and lean forward. I'm gonna listen to the apex of the heart. And also on that left sternal border. Okay, and I don't hear a murmur or anything, so that's very good. And now I'm going to go ahead and move to your upper extremities. Can I have you, I'm just gonna do some motions. I'm gonna have you follow me with those, okay? Like this, and back like this, and out, and in, like a traffic light, and like you're putting lotion on your back like this. You can do it one hand at a time if you need to. Okay, and for the elbows, I'll have you put your arms up like this, and out, like you're holding a bowl of soup, like you're dumping it out. And then for the wrists, I'll have you put your hands and fists, and bring them up, down, in, and out. And for your fingers, I'll have you clench that fist, and then bring them out, and then spread your fingers, and bring them back in. Alright, and now I'll have you put your arms just like this. I'm gonna try and pull on them, and you're gonna bring them towards you. Okay, and then I'm gonna try pushing them and you push down. Okay, and now I'm gonna have you put your hands and fists like this, and I'm gonna push down on them and you're gonna try and push up. Okay, and then I'll have you spread your fingers out, and I'm gonna try and push in your fingers, and you're gonna try and stop me, okay? Okay, and now I'm going to go ahead and move to the abdomen. I'm going to have you lay back for this. And I would normally just do this on her exposed skin. I would check just the symmetry of it, the contour that's nice and round, the color. Make sure that the color looks normal for her. The umbilicus is flat. And now I'm just going to go ahead and have a listen here. I listen in all 4 quadrants for at least 15 seconds. Okay, sounds active in there, and I don't see any pulsations or anything, just right here. And I'm gonna do some light taps here. Just checking for any abnormalities. Kind of all over here. Okay, and now I'm going to go ahead and feel around on your stomach a little bit. I'll start with kind of that light palpation, just again feeling for any lumps or abnormalities. And you let me know if you feel any tenderness, all right? No tenderness? Okay. I'm going to go a little deeper here. Again, you just let me know. Okay. All right, and now you can go ahead and sit up again, and I'm going to look at your legs here. Just looking at, they look symmetrical in size. The color looks good. I don't see any abrasions or anything. I don't see any swelling in the calves, ankles, or feet at all. And I'm going to go ahead and check the popliteal pulse here. You can go ahead and just let your legs relax. Okay. And the hair distribution looks even here as well. I'm going to check that posterior tibial pulse and the dorsalis pedis pulse here. Okay, and I'm gonna have you stand up here and we're gonna do your range of motion. I'm gonna have you bring your knee to your chest as well as you can here. Okay, and on the other side as well. All right, and I'm gonna have you cross one leg over and bring it out. And then lift it up like this and then rotate it in. Okay, same on the other side. Cross over, bring it out, lift it out, and then rotate it in. Okay, you can go ahead and sit down for the rest. I'm going to have you, your knees are flexed right now, so that's good. I'm going to have you extend your knee, and then I'm going to have you kind of move the bottom part of your leg in, and then out. And then on the other side as well. And then in and out. Okay, and I'm going to have you point your toes towards the floor. And then up toward the ceiling. And kind of curve that ankle in. And go ahead and curve it out here. Alright, and I'm going to just check the capillary refill here. And make sure the temperature is good here as well. Okay, and now I'm good to move on. So I have here the sharp and the dull end of this Q-tip. And I also have a couple of hot and cold test tubes. And I'm going to place these on different parts of your body. And I want you to tell me what sensation you're feeling, okay? And I would normally just do this on naked skin, but because she is closed, I will be doing it over clothing. Alright, so if you close your eyes for me. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Hot or cold?
Hot.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Hot or cold?
Cold.
Sharp or dull?
Sharp.
Hot or cold?
Hot.
Hot or cold?
Cold.
Okay. Very good. And I'm going to have you touch your thumb to the tips of all your fingers. You do that for me? And do it one hand at a time here, as fast as you can. Okay, and do it on the other hand. Alright, and I'm going to have you put your finger on your nose. I want you to touch my finger with that one and then bring it back to your nose. Okay, and now I'm just going to test your reflexes here and test your bicep one here. Okay, and your patellar one, you can just relax that leg. All right, and the Achilles one. Okay, and while I'm here, I'm gonna test the plantar response. Okay, and I'm going to now test your gait. So I want you to get up and just walk across the room just at your normal pace. All right, and on your way back, I'll have you walk heel to toe. All right, very good. And now I will have you just stand with your eyes closed with your eyes open for 30 seconds, and I'll have you close them. So you can go ahead and close them now. And I'm just checking to make sure her balance is good if she sways or anything. Okay, you are good to open them. And I'm gonna have you bend over and touch your toes. And I'm gonna check the curvature of the spine while she does this. Looks good. Okay, you can stand back up. I'm gonna have you extend that back as much as you can. I'm gonna have you lean to the side, lean to the other side. Have you kind of rotate around with your shoulders. Okay, and I think that is about it. Do you have any questions for me? Okay, well, I am going to go talk to your doctor. I will see if he wants to schedule a follow-up, but other than that, I think we are done. Thank you.
Thank you so